Have you ever retired for the night feeling fatigued, although your thoughts remained incessantly active? Have you observed that your memory is not as acute as it once was, names eluding recall, words lingering at the precipice of articulation? Do you awaken with rigid joints, chilled extremities, or a lethargic head that remains unclear for hours? Numerous elders perceive this as merely a consequence of aging. What if I informed you that inadequate cognitive clarity, diminished blood circulation, disrupted sleep, and morning lethargy frequently originate from your dinner plate? Moreover, here lies the unsettling aspect that most individuals hardly discuss. Inadequate cerebral circulation during nocturnal hours may gradually elevate the risk of cognitive deterioration, vertigo, equilibrium disturbances, and potentially stroke. However, remain with me. Tonight, I will disclose 3 uncomplicated vegetables that most elders are already familiar with. However, nearly no one utilizes them correctly to enhance cognitive clarity and promote blood circulation during the night. Crucial notification prior to proceeding: if you are a newcomer, kindly subscribe to this channel. This channel is specifically designed for elders. Weekly, we disseminate natural treatments, medical insights, and lifestyle strategies to enhance digestion, safeguard cardiovascular health, fortify bones, enhance cognitive function, and elevate energy levels post-60. By subscribing, you ensure that you receive essential guidance to maintain your health, clarity, and independence as you age. Let us proceed, as the initial veggie may already reside in your kitchen. However, it is possible that you are utilizing it incorrectly. Reasons for deterioration of blood circulation and cognitive clarity post-age 60 expanded. Prior to discussing vegetables, it is vital to understand the underlying reasons behind this issue, since understanding the why will elucidate the answers significantly. As we age, our bodies undergo subtle transformations that can go unnoticed initially. A significant alteration occurs throughout our blood vessels. In youth, blood vessels exhibit softness, flexibility, and elasticity. They readily expand and efficiently transport oxygenated blood throughout the body, particularly to the brain. However, post the age of 60, blood vessels gradually start to diminish in elasticity. Medical professionals refer to this phenomenon as stiffening, but a more accessible way to conceptualize it is as follows. Consider a fresh garden hose in comparison to an old one. A new hose is pliable, sleek, and facilitates unobstructed water movement. An aged hose gets rigid, constricted, and occasionally exhibits minor blockages. The water continues to flow, albeit with diminished strength and smoothness. A similar phenomenon occurs throughout the body. When blood arteries become rigid or constricted, circulation is impeded, oxygen transport is diminished, nutrient supply to neuronal cells is compromised. The brain is highly sensitive to oxygen. Minor alterations in blood circulation can influence cognitive clarity, memory retention, and overall sense of restfulness. Consequently, numerous elders observed nuanced yet exasperating alterations, such as word retrieval difficulties, morning cognitive fog, or requiring an extended period to achieve mental clarity post-awakening. When blood circulation diminishes, multiple occurrences may occur. The brain receives diminished oxygen, adversely impacting concentration and memory. Sleep becomes more superficial and fragmented. Morning headaches occur with greater frequency. Extremities experience increased coldness due to inadequate circulation. Balance may deteriorate, heightening the risk of falls. Moreover, there exists a crucial aspect that many physicians fail to elucidate adequately. The brain mostly conducts its reparative functions during the night. During sleep, your brain remains active. Indeed, it is really busy. It is eliminating waste, repairing cells, enhancing memory pathways, and replenishing energy. But all of this restorative effort relies on adequate blood circulation. Poor circulation during sleep inhibits your brain's ability to repair itself effectively. This explains why certain elders awaken feeling more fatigued than when they retired for the night. They slept, but their brain did not achieve complete recuperation. Possible observations include feeling fatigued after sleeping 7 to 8 hours, awakening with a sensation of heaviness or mental fog, cognitive sluggishness persisting till late morning, feeling shaky upon initial standing. Numerous individuals presume this is just normal aging, although in many instances it is in fact circulation-related aging, which constitutes a significant distinction. Here is the uplifting aspect, which is where hope emerges. Blood vessels are not inert conduits, they constitute living tissue. Even at the age of 60, individuals can exhibit favorable responses to the appropriate nutrients. Specific meals facilitate the relaxation and dilation of blood vessels, enhancing oxygen delivery, especially when consumed at optimal times during the day. Here is where the significant role of vegetables comes in. Certain vegetables inherently enhance nitric oxide production, diminish vascular inflammation, and promote nocturnal circulation. They work discreetly, delicately, and securely, without disrupting the system. Consequently, numerous seniors who implement small modifications to their overnight diet observed clearer mornings, deeper sleep, reduced dizziness, increased warmth in their extremities, enhanced balance, and improved cognitive sharpness. Moreover, these modifications do not necessitate stringent diets, supplements, or pharmaceuticals. They start with basic vegetables, cooked appropriately. Remain with me, as the first veggie we will discuss is one of the most potent natural enhancers of circulation known. Many seniors consume it, but not in the manner that optimally benefits their cognitive function. Vegetable number 1. Beets, the nocturnal circulatory enhancer. Beets are among the most extensively researched vegetables regarding circulation. They are abundant in natural nitrates, which the body converts into nitric oxide. Nitric oxide facilitates the relaxation and dilation of blood vessels. When blood vessels dilate, blood flow to the brain is enhanced, oxygen transport is optimized, blood pressure decreases gradually, and circulation at night is augmented. Consequently, numerous seniors who consume beets consistently report saying, "I awaken with enhanced clarity, my head feels less burdened, my hands are less cold in the morning." But what most individuals remain unaware of is timing is more important than quantity. Consuming beets in the evening, around 2 to 3 hours prior to sleep, may enhance nocturnal circulation. Guidelines for seniors on the safe consumption of beets. Start modestly, 1/2 cup of cooked beets. Refrain from consuming raw beets in the evening due to their difficult digestion. Optimal preparations: steamed beets, roasted beets, beet soup. Suggestion: incorporate a small amount of olive oil or lemon juice to enhance absorption. Who should use caution? Consult your physician before consuming beets regularly if you have kidney stones or significantly low blood pressure. Do you currently consume beets? If affirmative, do you consume them in the morning or evening? Please inform me in the comments. But remain with me, since the second vegetable functions differently. Many elders undervalue it. Vegetable number 2. Spinach, the cognitive enhancement leaf. Spinach is beneficial not only for bone health, but also for cognitive function. Spinach comprises folate, which is essential for memory, magnesium, a vasodilator, vitamin K, which facilitates cerebral signaling, and antioxidants that protect neuronal cells. Low folate levels are associated with cognitive impairments, reduced processing speed, and mental exhaustion. Here is the unexpected aspect. A significant number of elders are unaware that they are magnesium deficient. This may result in suboptimal sleep, nocturnal leg cramps, cognitive impairment, and anxiety. Spinach subtly restores magnesium levels, especially when consumed in the evening. Optimal methods for seniors to consume spinach: lightly cooked, not raw in the evening, incorporated into soups, eggs, or lentils, combined with healthy fats such as olive oil. Refrain from consuming substantial raw spinach salads in the evening, since they may induce bloating. What are the consequences of not consuming leafy greens? Reduced neural signaling, elevated inflammation, accelerated cognitive aging. May I inquire whether you prefer spinach cooked or raw? Would you consider incorporating it into a warm evening meal? The third veggie may surprise you the most. Vegetable number 3, garlic, the quiet circulatory restorer. Garlic has been utilized for millennia, not only for its flavor, but also for its effects on circulation. Garlic helps in reducing blood viscosity, enhancing vascular elasticity, supporting cardiac rhythm, and facilitating oxygen transport to the brain. But what many seniors fail to comprehend is that garlic is more effective at night when the body undergoes